Assalamu alaikum. Today we are going to talk about how to do wedge placement in a class 2 restoration so that neither do you have an overhang at the base of the box or your contours are also not compromised at all. When I'm doing a class 2 which is this deep, normally the soft tissue is all infected and irritated. Hence I would use an electrosurge to clean up the gingiva right there to make sure there's no bleeding spot. And that's the first step I would do. We have matrix bands available. I use a regular TOEFL mile one and I normally cut it into small sections. Then I would use the back of my cotton plier and curve it just like they do in balloon shops when they curl the ribbons. So if you do this, you can get a very nice curl custom made to your size. You can also buy these matrix bands. These are very nice ones with a little space right there. If you drill a hole into it, then you can pull it out, and I'll drill a hole into it. So here with the burr I drilled a hole. That way I can wedge it into place, and once I want to take it out, I can engage an explorer into it and pull it right out. So let's say we get this, and I'm not going to use these nice ones. I'm going to use the one that I made myself, and we put that in like that. And you make sure that you are all the way into the depth of the sulcus. Now if you see a little hole right there, you see right there, we don't want any food getting stuck inside, and we don't want an overhang. So what I'm going to do is I'm going to take a wedge. Normally the decay is wider on the buccal and it's less wide on the lingual. In this case it seems to be more wide on the buccal. I'm sorry, on the lingual or the palatal. So I'll go ahead and I'll stick my wedge from the palatal to the buccal. And as you stick your wedge in, you got to make sure that the wedge is wedging the teeth apart as well. And in order to do so, this is what it takes. You got to hold the back of the cotton plier and you got to really squeeze it. Here, since this is acrylic, it's not going to move. But if you squeeze it really tight, that is when everything is going to hold together and the back tooth is going to open up slightly bit. So as you put the wedge in, make sure you hold the back of the wedge with cotton plier, and you can use finger pressure up on the outside and squeeze it really tight. And you got to squeeze really tight to make sure that not only does the matrix band adapt to the cavity very nicely, it pushes the posterior tooth backwards into the PDL space. The reason we need to push the tooth backwards is to allow for the thickness of this band. If you do not wedge it very tight, then the moment you remove the matrix band, there'll be space right there and food is going to be impacted. Now once this part is done, it is very critical to go in and use an explorer and clean up all the debris that's stuck between the matrix band and the tooth structure. So use an explorer, clean back and forth. Now you can acid etch and do whatever you want. And when you're doing the composite, fill up the composite, let it flow outwards, and before curing it, I would hold the matrix band like this. You see, when you hold the matrix band onto the tooth, you will get very nice contours right inside, buccal and lingual. Remember, we already curved the matrix band, so it's adapting nicely. Here, the matrix band is adapted too nicely. We need to build a corner right there. So what I'll do is I'll first put the composite right there, only halfway through. Then I'll put the composite inside in this area and hold this corner out by holding the facial out and the explorer distally. This way I'm going to get a very nice cusp formation right there, and you got to use your finger to hold it tight. And once you get this composite done nicely, all you have is a little bit of flash on the buccal that you can remove with a composite polishing burr. Same thing if you're missing half the tooth, hold it, squeeze it like this, build up the composite nicely right in this area. Hold the matrix band and build up the composite. In case the matrix band falls right back, use an explorer, and this space can be filled again the moment the first cure of composite is done. This way you get very nice composite tight composites. And then when you want to remove it, don't try pulling just the matrix band out this way. You push the wedge back in like this. The wedge gets loose, you take the wedge back out, and now matrix band is going to be stuck very tightly. So you're going to have to hold it with some kind of cotton pliers or hemostats and pull them out. In case it doesn't want to come out, use a burr and make a hole into the matrix band. Engage your explorer or rotate the matrix band and pull it right back out. You'll have very nice and tight contacts every single time.